It's a shame. It's extraordinarily unfortunate that that kind of racial disparity is showing up in the data, but it's not surprising. Folks in the African American community have had difficulty getting access to this vaccine. And while the state has responded at least somewhat to our concerns, the response from the state hasn't been enough. There needs to be very targeted, very consistent, ongoing outreach to the African American community to get this vaccine to them, and not just to the African American community, but to our Latino community as well. You have to remember that among the folks who are most exposed to this virus are frontline workers, the folks who are scanning our groceries at the grocery store, our sanitation workers, our teachers. Those folks skew disproportionately as people of color. And so they're taking all the risks every single day so that we can continue to live civilized lives. But they're not getting access to the vaccine that could prevent them from getting this virus, getting sick from it, and dying from it. And the data showed that as far as infections, as far as death rates, and excuse me, the data show this also with respect to access to the vaccine.
At the outset of this, people were told at the state and the county and even the local levels, you know, let's make this fair. And it wasn't. Where did they go wrong?
When you don't make an effort to close these racial disparities, they're not only going to continue to exist, but they're going to perpetuate themselves and become even worse. There was a racial disparity with respect to COVID-19, with respect to who is getting it and who is getting sick and dying from it. And if the state didn't make a special effort to correct that with this vaccine distribution, it's no surprise that it's going to show up there. And so what we're seeing is, we're seeing the state, we're seeing Governor DeSantis roll out vaccination distribution plans that don't work for people of color. And then we're seeing communities of color get outraged at the fact that they're not served by these plans. And then we're seeing the state after the fact scramble to accommodate these communities. And that's an ongoing cycle. That is the essence of systemic racism. And that's what we've seen with COVID-19 infections. That's what we're seeing with the vaccine distributions. We need somebody close to the governor who is thinking about racial equity and who is looking at how can we ensure that everything we do with respect to this vaccine distribution has racial equity as a consideration, because if it's not top of mind, you're going to get results like this.
Anything else to add? I've got to turn this around. This will be on at 5:30 or 6 tonight. We're still in flux. Anything else to add?
What these racial disparities show is that people of color who want to survive this pandemic just like anyone else aren't being given the same opportunity to get this life-saving vaccine. And that's a shame, because what we're all trying to do is just survive. We're trying to make it through this pandemic alive. And so it's incumbent on the governor and the folks around him to move heaven and earth to right these wrongs. Because if they don't, people of color will pay for it. And will pay for it not only in lost health, but in lost lives as well.